Hello, good afternoon. Welcome once more to Ask Your Midwife. I'm Patience Efrifa, a senior staff midwife. And then today I'd like us to talk about birth preparedness and then complication readiness plan. And before I continue this topic, I'd like you to subscribe to my channel, like the channel, and then share this information with friends and family. Now back to our topic. When we talk birth preparedness, is not something I'll say it's medical that we wouldn't understand. We're talking about preparation for birth. Let's take for instance when you are traveling to a particular destination, or you're traveling to somewhere, you prepare or you plan. The same way also happens when you are pregnant and you are preparing for the new family member or the new visitor who will be part of the family. Now, with birth preparedness, we have list of items. We're talking about the list of items that you, a pregnant mother, supposed to have before you come to the labor ward. And this list of items, you can get them from your midwife or from the gynecologist or specialist who attends to you. Why am I particular about this topic? Because as a midwife, we have cases or instances whereby women who have been able to become pregnant and have been able to go through good 9 months and come back without even a sanitary pad or rubber for birth. So what always baffles my mind was, what happened? Is it that the fellow didn't attend antenatal? Is that the fellow just magically got up and became pregnant? It baffles me a lot. But one trend that I also got to know was that some don't attend antenatal. Because if you do attend antenatal clinic, I believe your midwife would have given you that layette or the list for you to buy a few, even if you cannot buy all, just a few that the midwife can use to help in conducting a delivery. All right. So what are some of the common things that we are supposed to find on the list? I would like to hammer on the most important one. I'm not saying they are not, the rest are not important. The rest are important, but we have some that during emergency, at that moment, we can use it for you. Then later, they bring the rest of your things. The first one I'm going to talk about is sanitary pad. In Ghana, we use the Fatex pad because the Fatex pad is 100% cotton and it's able to absorb enough blood, because when it comes to labor, it's mostly blood and blood products. So the Fatex is recommended because it absorbs enough blood. I'm not doing any advert for any company, but that is what we mostly use. So there are other ones that we use, but all we have to make sure that it should be 100% cotton. Then you can talk about the delivery mat. The delivery mat also, don't get the small ones, because the small one at the end of the day, after delivering, when you lie on it, it can soak the bed and soil your stuffs. Then the third one I like to talk about is a suction bulb or syringe. That one, or a mucus extractor, that is what we call it, but I'll say suction bulb. That one is easier for you to understand. The suction bulb is to suction any secretion that the baby might have taken into its either its respiratory tract or into its body, so that it will not occlude the nurse or occlude the respiratory system for the baby to be able to establish good respiration. Then we can talk about the baby diaper, baby dress. At least if you come with one, that is for emergency purposes, you come with baby dress, either one or two. That one too, we can use it for the baby. Then we have old cloth. The old cloth, we are not saying that it should be old and dirty. It should be an old cloth, but neatly ironed and it is also neat to prevent any form of infection to the baby. And then cut sheets. The cut sheets, if for emergency purposes you can get like 2 or 3, then later your relatives can bring some. The cut sheets should be warm enough, well washed, well ironed, and please don't put camphor in them. At times mothers will come in and after delivery you can smell strong scent of camphor in the cut sheets. At the end of the day, when you use it to wrap the baby develops catarrh, and at the end of and then you, the mother, you end up being anxious. Then we have to take this baby to pedics for them to assess whether baby is fine or not. So because it's a strong scent, too strong for the baby, don't put camphor in it, please, mothers. Even if you use camphor in it for preservation, when your time is getting due, you rewash them again and iron them. Yes. Then you can talk about old graphic paper. The old graphic paper or old paper is after delivery. You need to change your sanitary pad because there will be flow of lochia or that blood that you see. So you use it to nicely wrap that old. You use that old paper to wrap it the used pad nicely for it to be discarded safely into a bin. All right. Then we can talk about Savlon. The Savlon is for you, the mother. Blood has some kind of funny smell. So after delivery, you pour it into your water. Then after 24 hours, you can take your bath nicely. Yes. And at the same time too, when we are bathing your baby, we can use that same thing to nicely clean the baby for the baby to smell good. Then other ones are also important, like your nightgown and your hair net, just like this one, to protect your hair after delivery and all that. But the most important ones are what I've hammered on, because when you have these small ones available during an emergency, we can quickly perform delivery for you. Then later you can call your relatives to bring the rest of your things. It is better to go with these small items than to go with nothing. Then you have issues with your midwife, or you yourself, you won't even feel comfortable. And the midwife will have to be going around begging or soliciting for things from your colleague pregnant women for you. All right. Then the complication readiness plan. With the complication readiness plan, we don't mean that we as midwives don't want any mother to have complications, but some of these things are bound to happen. So what are some of the things I'm talking about? One, the one going to take care of you, that is somewhat be closer to you, that in case of emergency can quickly rush for early intervention. Let's say if you need blood, there should be someone there to quickly rush. If there is no blood in that particular facility, they quickly rush, then secure one for you from a different facility. Two, when there is the need for us to rush you to theater, the relative is supposed to be around to sign any legal document or paper. At the same time, to also be available to help procure drugs from the pharmacy for you. Though at times when there are no relatives, we can do dear pharmacy for us to get some start drug. When I say start drugs, that means petty things which you can start the procedure with. Then later you get the rest from the pharmacy. Then 3, you have to donate at least 2 units of blood. At least 2 units of blood. Not you, the pregnant woman, but your relatives. During your antenatal visits, your midwife will tell you to get at least 4 people who will be able to donate at least 2 units of blood for you, so that in case there is an emergency, in case you are bleeding and there's a need for us to replace blood, we won't be going helter-skelter. Your blood will be well secured for you in the blood bank, so that if anything, we can save your life. We can save your life, because there are certain things that are avoidable.